I think that British Columbians are in danger of engaging in the wrong conversation about health. And even though I have signed up for that conversation, and I think everyone else should too, but I think that the whole conversation is wrong-footed. You look at the headlines every day, and others have mentioned that the talk is about rationing, it's about privatization, it's about my personal bugaboo is this new project that I forget the name of because it irritates me so highly. It's the retread of participation, where we'll all be healthier if we all just get a little bit more exercise, and we're putting ACT now, thank you, put all more money into that. Not that those aren't good ideas, but in terms of what the conversation should be, I find it kind of irritating. Back in 2001, Michael Rackless and Bob Evans and a couple of others did a report called Revitalizing Medicare, Shared Problems and Public Solutions, and they talked about in there the rhetoric of crisis, and it's what we've been addressing today as well. That the conversation we're having is all about sickness care. It's not about health. And we need to refocus in on health in order to be able to get control of the sickness care system, for lack of better and more positive language. But I think we're on the wrong foot on the discussion unless we can shift it truly to a discussion about health. We're social democrats. We really have to take an approach when we develop policy, and that's what this conversation here is today. It's the beginnings of our conversations inside our party about where we're going policy-wise. And I think we have to refocus on social determinants of health and talk about how we create environments in our communities that are conducive to health, so that we can provide the kinds of the supports through the health service system that complements what people need in their lives to live full and healthy lives. Now, the World Health Organization definition of health is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The community health centers that I've worked with almost all my life use that as their definition of health. I've had community health center style health care since I was 8 years old, middle of 1962, when the doctors went on strike in Saskatchewan. The response in our communities was to set up our own health care co-ops, that we can provide the services for ourselves that others weren't willing to provide for us, because we felt quite firmly then and feel quite firmly now, as does the World Health Organization, that a high standard of health is a fundamental right. Health services are one part of it, and I think we have to be very aware of that. But this morning you heard Mr. Kershaw, Dr. Kershaw, talking about child development, and WHO, in their documentation 50 years ago, was saying healthy development of the child is of basic importance. The ability to live harmoniously in a changing total environment is essential to such development. So we need to take a really holistic look at how we think about health, how we think about our communities, and how we then find a proper place for health services within those communities. We have to really move this conversation about social determinants into the fiber of the New Democratic Party. And when we talk about health, we have to talk about all of the things that contribute to health. At the same time, we know that universal access to medical care is clearly one of the determinants of health. And I think the message is getting out in some ways. The Chief Medical Officer of VHA, Vancouver Island Health Authority, is said in a report this year that addressing the social determinants poses a unique challenge to public, private, and nonprofit sectors of the community, and that it's evident that further advances in healthcare will be increasingly dependent on our ability to address the social determinants in a collaborative way. So, like, even, you know, there is some move within those organizations to look more particularly at health determinants. The chief medical officers have been remarkably vocal on these things. John Miller in '94 was saying, studies demonstrate that the more equitable the distribution of wealth, the healthier the population. While the total amount of money in a society is important, it is more important that available income be shared equitably amongst the population. And Michael Rackless continues to do a lot of work around social determinants and around health services place in social determinants. And he always, when he's talking to us like he did at our convention last year, reminds us about what Tommy Douglas said. Tommy said, "I'm suggesting that when you're fighting the battle, as I hope you will, to maintain Medicare, you'll not forget that the ultimate goal of Medicare must be the task of keeping people well, rather than just patching them up when they're sick." So, and Michael... Michael really always refers back to Tommy Douglas. And I think when we think about what Paul Kershaw was talking about this morning, and we think about the challenges that are in front of us in terms of how we provide necessary services to people, that we need to make a real commitment to acts of political will in order to shift the conversation about health. We need to take vested interests head on. We need to take on the physicians about whether the physicians are truly should be the gatekeepers for the whole system. We need to take on the issues of remuneration, how we remunerate people in the system. We need to take these issues on because, and we can't lose in doing it, because we lose if we don't do it, for sure. On the issue of looking after children, I talked to a friend of mine who's a nurse in the Fraser Valley, works in one of the big mat wards, and I said, I'm making this presentation, and I'm going to talk about how important it is to look after the nutritional needs of children, particularly in that ODA 2 age group. And she said, "You're forgetting about the health of the mother, Cheryl. It starts before that." And it goes back to what someone raised earlier this morning. We have to support families. We have to make sure that there are living wages for parents, that there's proper nutrition for mums and babies, that there's opportunities for proper education, that that children are housed, that they're not living on the streets, they're not living in temporary housing, they're not couch surfing with their parents. We have to address those issues as health issues. BC has the highest rate of child poverty in Canada. Many years from now, that is going to translate into higher health needs and higher costs if we don't address the issues of those children now. So I wanted to end with a little message about a conversation. I have this neat book that I can't find the piece of paper from. See, I knew I'd drop it. There it is. It's a book called Turning to One Another, Simple Conversations to Restore Hope to the Future. And Margaret Wheatley says, "Many of us would like to simplify our lives and lives in general. Yet I notice how difficult it is to accept and believe in simple solutions and processes. Everything has become quite complicated. Things that were simple, like neighborly conversation, have become a technique, like intergenerational cross-cultural dialogue. In the presence of so many specialized techniques for doing simple things, we've become suspicious of anything that looks easy. And those of us who have technical expertise are particularly suspicious." She goes on to say, "There may be another reason why people in general hesitate to believe in simple solutions. If it's so simple, why haven't we thought of it earlier? But simplicity has a powerful ally," she says. "It's common sense. If we reflect on our experience, we notice that good solutions are always simple, much simpler than we thought they'd be. Everyone has this experience many times over. Scientists are taught to look for simpler solutions. If there's a choice between two possibilities, they choose the simpler one. Simple solutions are called elegant in science." So I think we need elegant solutions. We need to redefine primary care. We need to look after children and their families, and we need to look after the most vulnerable in our society, and then we'll be healthier. Thanks.